Many cancer types are typically staged, but that's not the case with AML. AML is often considered low risk or high risk. Is that right?
Yes, and I think that's very well how you put it. And we can even, they even add an intermediate risk by now to it. Mm-hmm. And I love this question because that's what I like to study, or what I'm studying in here. The one important thing to keep in mind, and this is something like even many hematologists don't think about, is that the risk assignment of acute leukemia, of AML, if you think about it as low or high or intermediate risk, is risk, or is actually, better said, not risk, but chances to respond to conventional chemotherapy. So the way how this was defined is that if you have, for example, a multitude of chromosomal abnormalities, what we call a complex karyotype, you would be considered adverse risk. And this means your chances of responding to the standard of care intensive chemotherapy are very, very low. And similarly, if you have other changes such as an NPM1 mutation, your chances are considered very high. So the risk assignment with our increase of treatments now changes. We still also, when I look at that, I think about it in the same way. But in my mind, if I'm talking to a patient, I'm trying to make sure to say this is considered an intermediate or adverse risk. But this means that I would not, at the first place, consider you for standard chemotherapy, but rather advise you to participate in a clinical trial or have an alternative care. The second implication, especially for younger patients, would be to, if you're intermediate or adverse risk, that you would routinely be considered for bone marrow transplant or stem cell transplant.
Okay. So what does it mean to be high risk then?
Mm-hmm. It means that your likelihood of going into remission with standard of care is very low. This means, and in very practical numbers, it might be as low as 20 or 30%. This meaning getting the leukemia into remission, and there are very important differences. The first step at every time, and this saying high risk, means if the patient receives a treatment, is how high are the chances that we can get rid of the leukemia? The second question is, how high are the chances once it's gone that it stays away, or how are high are the chances of relapse? In adverse risk, in most cases, it's both, a combination of both. The chances of going into complete remission are lower, and the chances of it coming back are higher. So we have to be very aggressive. And this means that we have to consider alternative treatment options, and that we, even if we are then lucky and achieve a remission, that we might have to move to more intensive additional treatments, such as a bone marrow transplant.